Hello, everyone. It's Dr. Yurkiw, and thank you for joining us for today's webinar on shoulder and rotator cuff pain. Many people suffer from shoulder and rotator cuff pain, and it's something that we help people with in the clinic. We've seen many cases of shoulder pain from injury and other causes. We're going to go over that today, and we're also going to talk about what treatment is available for that. If you have any questions, please type your questions in the chat window. We'd be happy to get to those questions. And again, thank you for joining us for today's webinar. My name is Dr. Yurkiw. I've practiced for 26 years. I saw a chiropractor when I was young, and that really changed my life at that time. My father had taken me to our medical doctor because I had a lot of knee pain, and the doctor had diagnosed it as growing pains, and the pain continued. And when I played sports and fell on the ice in hockey or on the playground playing soccer, the pain was excruciating. And even if I bumped a desk at school, there was quite a bit of pain. I had to stop and rub my knee and hold my knee for a while before I could continue. So I had gone to the doctor a few times to get treatment for it. It was diagnosed as growing pains each time. And my father heard of a chiropractor in our area that was treating a number of different joint problems. And he took me to that chiropractor. He did an assessment. He took X-rays, and he had me come back, and he diagnosed my problem correctly. And then he said he was going to start some treatment on my knees and my hips and my posture in general. He said everything's connected. There's nerve flow going from the brain to the body. There's joint function, and one joint depends on the other. And posture is very important in that process, especially as a person grows. And I was in a growth phase. I'm a tall person. I'm 6'2", and at that time, I was really growing. So he started treatment with me and did that on a regular basis. I went after school Monday, Wednesday, Friday. He did treatments, and my knee started to heal. And after a few months, I could run and I could fall on the ice in hockey. I could fall in the playground playing soccer, bump a desk, and the pain was gone. And that was just tremendously freeing for me. I could play faster, I could have the confidence, and my athleticism really grew, and my confidence in everything really grew at that time. So I'm very thankful to that chiropractor, and it planted that seed in my mind that if I could help people the same way this chiropractor helped me, that's what I want to do for the rest of my life. And here I am 26 years later in my career, probably 36 years since I saw that chiropractor. But that made a profound difference for me. I now practice in Kelowna, British Columbia. I have a practice here at the Landmark Towers, Landmark 4 building, and we are taking new patients. If you are looking for a chiropractor, we do have some extended hours, including weekends, Saturdays, Sundays, and holidays. Just a disclaimer, if you have shoulder problems and pain, rotator cuff, consult with the health professional, because what I'm talking about today is general concepts of what I've seen in the clinic, but really to give the best advice, somebody should assess you, know your condition and your history, and be able to give you the best advice possible to help you. So go and see a health professional, go see a chiropractor. If you're in the Kelowna area, you're welcome to come in and see us in the clinic, but definitely go and see somebody to get the proper advice and then get the proper treatment. And then you can change some of the things you do at home in order to support that. So what is rotator cuff? Rotator cuff is the musculature around the shoulder. It's the 4 muscles that come from the shoulder, wrap around into the front, and control the movements of your arm, like the sideways movements, like a forward lifting your arm. So there's certain movements that are controlled by the rotator cuff, and we're going to go over that today. How does shoulder pain start? Well, it usually starts from an injury or a fall. So there can be an accident, like a car accident, where the seatbelt pulls you back and the shoulder injures the shoulder and the alignment and the joint. It could be a work injury from lifting and putting things overhead. It could be a sports injury where you crash into the boards in hockey, or maybe you fall on your shoulder in basketball. Things like that. Maybe in tennis, there's a repetitive type of strain where you keep doing the racket backhand and forehand. It starts to pinch the biceps tendon or the rotator cuff tendons in the shoulder between the ball and the socket. Sometimes people sleep incorrectly. It compresses the shoulder. And when it compresses the shoulder, it causes a pinching of that tendon and the other tissues in the shoulder. And that can cause shoulder pain. So the anatomy of the shoulder, there's joints in the shoulder. So there's the ball and socket, the glenohumeral joint in the shoulder. There's the acromioclavicular joint. That's the joint that connects the clavicle, the collarbone, to the shoulder. So those are the two main joints that get injured in the shoulder, the AC joint and the GH joint. We're going to talk about that later on in the webinar. There's cartilage on top of the bone. There's synovial fluid within the joint to lubricate the joint, allow it to move. And then there's a capsule or ligament around the joints to keep everything together. And then, of course, there's muscles and there's ligaments around the joints as well. Those muscles allow the joints to function properly. Here on the side, you have the deltoid muscle group. In the front, the pectoralis muscle and the biceps muscle and the tendon coming in. So there's a number of different muscles on the back, the front, and the side of the shoulder that allow the shoulder to function properly. Then what holds everything in together is the fascia. The fascia, I tell my patients, it's like saran wrap that kind of keeps everything together so that so the muscles and ligaments and everything stay nice and kind of tight together. The nerves come from the brain and then down the spinal cord, and out between each segment in the spine, there's nerve roots. These nerve roots in the neck come together in the lower cervical region and form a brachial plexus. This plexus of nerves goes through the shoulder and then all the way down your arm. So sometimes what we'll see is a nerve that's getting pinched or affected in the neck or the shoulder that causes shoulder pain. So it's important to consider the nervous system. Pain stimulates the nervous system, so that it tells you there's a problem there. And we want to find out what's causing that. So in this illustration, you can see the spinal cord, the nerve roots coming out, and then the nerves traveling down the arm. Posture is very important. So some people have poor posture. They slouch or have increased curvatures in their back, like the lady on the far right here. She has a lordosis, kind of increased in the lower lumbar. More for the shoulder, we see a kyphosis, so an increased mid-back curvature where somebody is looks like they're slouching, or there's a scoliosis, the picture on the left bottom there where it says scoliosis. There's a curvature in the spine, and that changes the alignments of the shoulder and the way the shoulder functions. Or sometimes we see a very flat back too, with not much curvature in the mid-back. Important considerations for posture are the way you carry things like the bag on your shoulder. Even things like footwear can change your posture, your alignment, lifting heavy objects. There's a genetic predisposition to posture and things like scoliosis. Incorrect posture at the workplace, like slouching at your desk. Poor nutrition, poor sleep position, incorrect lifting in the gym or working with weights can sometimes pinch the shoulder. One of the worst ones is actually the incline chest press, where someone's lying on a bench and pushing up overhead at a bit of an angle. That can really pinch the shoulder tendons like the biceps and the rotator cuff if it's not done correctly. So here are the different postures that we see that can affect the shoulder. The flat back is the one that wasn't included in the last slide. That's the fourth one from the right, and that can affect the scapula, the shoulder blade, and the shoulder alignment. Something else to consider is text neck. Text neck is when the head is not being carried properly. So at a 0-degree angle, when there's proper posture on the far left, you can see that the head weighs about 5 kilograms. If the head is forward at an angle, like a 30-degree angle, it then starts to weigh heavier because of the poor alignment, and it's 18 kilograms of force on the spine. If it's at a 45-degree angle, 24 kilograms of force. And at a 70-degree angle, 28 kilograms of force. So you can see with poor posture, it can affect the weight of the head on the shoulders and the rest of the spine. So when someone has shoulder pain, what do? Well, we do an assessment, and part of the assessment is their history. We want to understand where the shoulder pain came from, if there's been previous injuries, if there's been postural stress. We basically want to understand what contributed to the shoulder problem. And then what we want to do is a postural assessment. We want to check the alignment. We want to check the shoulders and the alignment of the shoulders. We want to check the head and to see if it's level. Check the hips to make sure that that's level. And then check your posture from the side if there's any type of postural distortions like we saw on the previous slide. Once we know the alignment to the body, we will move on to other tests like testing the joint to see if it's the glenohumeral joint, the ball and socket, or is the pain coming from the acromioclavicular joint where the clavicle comes into the acromion in the shoulder. So there could be an AC joint separation there. We want to assess the function of the shoulder. So we want to see how flexible the shoulder is. And we'll do the ranges of motion like forward flexion and abduction sideways, adduction inwards, extension of the arm backwards, and then internal and external rotation to see what the ranges of motion are like in the shoulder joint. Want to see if there's any pain or pinching. So if somebody's doing a range and they say, oh, that's really painful, it's pinching my shoulder, and based on where they show us the pain is, that gives us a good indication of which tendons, which muscles, which joints are being affected. We'll do orthopedic tests, neurological tests. We want to see if there's any compromise of the joint or any compromise of the nervous system in that examination. Sometimes we'll take an X-ray. We want to look at the alignment of the shoulder on an X-ray, see if there's any pathology underneath that. Is there a fracture there? Is there a tumor in the area? Is there arthritis or degeneration in the joint? So an X-ray tells us a lot about the condition of the bones and the joints, as well as sometimes we can see calcification of a tendon or a ligaments or the joint, so we can see other things in the soft tissues as well. And one of the major consideration is how long has this problem been there, and are the joints starting to wear out, like in a condition like arthritis, osteoarthritis or rheumatoid arthritis. Those are the two most common types of arthritis that we see. Then we want to diagnose the problem. So is it a true rotator cuff issue, an impingement? Is it a separation of the acromioclavicular joint? Is there a strain of the musculature or a sprain of the ligaments? And then we want to check and see, is it cervical related? So is there pain coming from the neck area traveling down in the shoulder and down the arm? So it could be an origin right in the brachial plexus, the nerve roots coming out of the neck going through the shoulder. And then there's a bursa in the shoulder too. They're like sacs of fluid to prevent the muscle from rubbing on the bone, to prevent friction. So are the bursa swollen, or is there bursitis there? Depending on the diagnosis, we will put together a treatment plan. And the treatment plan, number one, is to provide relief to the patient. So we might start to work with the shoulder to do some treatment, and then give the patient some ice or heat to do at home, or some other recommendations just to relieve the pain and inflammation that's in the shoulder. Secondly, we want to correct the cause. We don't want the patient just to have short-term relief, but we really want to correct the underlying cause. And if that involves their posture, the way that their head and neck are aligned, the way their shoulders are aligned, we want to make sure we correct the underlying cause so the problem doesn't come back again. We'll give the patient some stretches or exercises. We'll give them some strengthening. We might even give them some recommendations for supports for that joint so that they can get the help they need so they can feel better and get the function or the strength back in the shoulder again. How long will it take? Well, it really depends on how long the problem has been there. It depends on the person's makeup, their genetics, and their history. It depends on the condition of the joint. So depending on all those factors, it can take weeks to months to heal a shoulder condition. We will provide active treatment for the stiffness and discomfort. We'll improve the nerve flow and the energy in the joint so it'll get stronger. We'll give some postural recommendations and work on the overall alignment. And we'll give the patient recommendations for better self-care so they can help along the way and eventually manage their own conditions so that they are strong and healthy. So we want to see them with long-term strength and stability in the shoulder joint. If you have shoulder pain, don't hesitate to reach out to us. You can call our office at 250-486-0062. We are taking new patients and we would be happy to help you with your shoulder condition. We are located in the Kelowna area in British Columbia. If you're interested in some reading material, I did publish a book on back pain on Amazon, and that was last year. So there is one on neck pain as well. So there's two books, one on back pain, one on neck pain. And you just have to type in the title and then my name, Yurkiw, and you'll be able to find it in ebook format, in paperback, and there is an Audible audiobook version as well. If you're interested in more webinars like this, you can sign up for them for free. You just have to go to our Eventbrite page, type in Yurkiw Chiropractic, and then you'll see something like this where you can sign up for our upcoming webinars. Today it's rotator cuff. On September 7th, for our new patients, we educate them. It's an introduction to chiropractic care. So we believe in educating our patients and the public, our community, about better health. On September 10th, are you having trouble sleeping because of joint pain? So we're going to do a webinar on that at 7 p.m. And on September 12th, we have a webinar on arthritis. What is it and how we can help? So join us for the upcoming webinars. They're free of charge. Space is limited, so please sign up early. And if you're having trouble finding our Eventbrite page, please send me a message. You can DM me or email or call us. And here's our contact info. We're at 105 1628 Dixon Avenue in Kelowna. Phone number is 250-486-0062. And the email address, drkerryyurkiw@gmail.com. If you're here at the webinar and you want to come in and get checked, we're offering you 10% off the initial assessment. You can book that online or call our office to book an appointment. We are taking new patients. This offer is good for 7 days until September 13th, 2020. And just use the code SHOULDER. So just let us know you're at the shoulder webinar, and we'd be happy to book you in and take 10% off your initial assessment. I want to thank you guys for joining me today. I look forward to seeing you at the next webinar.